A push to make sure Latino children have continuous health coverage during their crucial early years of life. Right now, New York State wants to make some drastic cuts to Medicaid. We'll get to the impact of that in just a second. Latinos have long faced health care challenges. We've talked about it here on Tiempo often. According to an independent health policy research poll, Latino children are twice as likely to be uninsured. Healthfirst, the largest not-for-profit health insurer, wants to raise awareness to help stop the gaps in coverage for Latino children. And helping us understand it all this morning, Dr. Maya Castillo, pediatrician and medical director at Healthfirst. Welcome. Thank you for helping us, because this can get a little convoluted. Yes. So we're going to keep it simple here. A lot of this has to do with something called churn. Explain for me what churn is and why that's important.
Yes, Joe. Well, many children are covered by Medicaid. And in fact, in the state of New York, over 60% of Hispanic children are covered by Medicaid. Now, it's wonderful. Now, every year, a parent and a person on Medicaid has to recertify, which means they have to say, yes, I am still eligible for Medicaid. I didn't move out of the state. I don't make too much money. I am able to accept Medicaid. It's a good thing. However, we know that most people, especially most kids who lose their Medicaid, it's not because they don't need Medicaid or they don't qualify.
What is it?
It's because they don't know how to do the paperwork. They've moved, they don't get the paperwork. They don't know they have to do it. So it's what we call procedural reasons. And nationwide, we know that 3 out of 4 children who fall off Medicaid in a year and have to get back on Medicaid, it's because of these procedural reasons that they really fall off.
So it sounds like an administrative problem.
It's papeleo.
And why, papeleo? Why is it more? Why is there such a disparity with Latino families?
Well, for Latino families, there's a couple of reasons. One is the language barrier, right? So we know that people who have English as a second language are much more likely to not understand the paperwork, not be able to know the process to recertify. But there's also the factor of having a non-citizen parent.
Yes. Oh, I was waiting for that.
Yeah. So there's a lot of fear and misunderstanding around what it means to go in and put details down on a piece of paper, right?
And you know, I can see the hesitation from non-citizen parents. Tengo que apuntar mi nombre aquí en este papel. You know, they don't want to write their name down and then give it to the government for whatever reason.
And there's a lot of misinformation out there, but it's the problem is that these young kids who are really so vulnerable are the ones who end up losing out.
Is it your impression, therefore, that Latino parents, many of them, get turned off by the difficulties and the challenges, and they look at their child and say, se ve bien, todo bien, I'm going to leave it alone, no paperwork, we'll be fine?
I don't think that. I don't think people do it because they think it's too much work. I think they really, you know, if you think about a parent of a young child, especially a parent living in poverty who has 2 jobs, right? They're just trying to get through their day, get the kid to school, get the other kid to daycare.
Daily challenges.
All of these things, you know, that one more thing of having the stack of paperwork and having to go somewhere to have someone help you, it might be too much.
Let's talk medical. You're a pediatrician. What are the healthcare risks of a gap in coverage?
Healthcare risks are huge, especially for young children.
Enumerate them for me.
So young children need a number of vaccines to prevent serious illness in the first few years of life. We know that kids who experience gaps in coverage are more likely to be unvaccinated or under-vaccinated. So, you know, they're not getting the pullas. You know, also the first few years of life are when pediatricians really look for delays, developmental delays, behavioral emotional issues. We already know that Hispanic children are much less likely to get diagnosed with a developmental delay than white children, and they're also, even when they're diagnosed, much less likely to get services.
So all the things that you would need to address early in life, left unaddressed, can really impact you later in life.
Whole life. You know, these kids' whole life. They're not ready for kindergarten. They haven't had their language assessed or had speech therapy if they're having difficulties. Pediatricians also look for family needs, right? You know, problems with housing, unsafe conditions, food insecurity, right? A child's developing brain needs those healthy things to grow.
You are lobbying Albany, correct? Because what's happening now might have people out of practice because of what happened during the pandemic. Explain to me what's going on there with enrollment and re-enrollment.
So prior to the pandemic,
yes,
people had to recertify their Medicaid every year. However, during the public health emergency, what happened is it was halted, right? It was stopped. So everybody got to keep their Medicaid for the duration of the pandemic. Last year, we began to recertify again.
Okay.
Right, so now everybody has to recertify. There's a number of people who've never done it, right? I mean, imagínate, you have like a 2-year-old, right? You've never done this for your child. You've just had Medicaid this whole time.
Okay.
So suddenly you have to recertify. It's not something you were necessarily aware you had to do, right? So we're seeing a lot more children and people falling off than were before the pandemic.
During our break before, you were telling us the numbers dictate that enrollment in 2022 took off. It was really high, correct?
Yes, it was great. It was the most stable that it's been for children in New York State ever in terms of Medicaid enrollment.
Are you fearful that number is going to plummet if the word doesn't get out about enrolling again?
Absolutely, absolutely, and especially for Latinos and Hispanic children. We've seen that the drop has been so significant, upwards of 12% for Hispanic children.
You're going to Albany, you and your Healthfirst colleagues and other nonprofits, lobbying legislators to push for something for kids ages 0 to 6, where they would not have to enroll every year. Do I have it correct?
Yes, not have to enroll at all. So it's called continuous eligibility.
Okay.
All children from birth through 6 years of age, their 6th birthday, would be on Medicaid unless their parent certifies they have some other type of health care coverage.
Okay.
So this would prevent any type of paperwork needing to be done from 0 to age 6. So parents, even fluctuations and small fluctuations in income, right? A parent, say they make $25 more a year, their child would not lose insurance and they would not have to recertify. The child would be insured.
Does the current budget proposal that the governor has come forward with put that pitch at risk?
Well, they're putting the pitch in, but we'll see if they put it through, right? This is a proposal. It would be an amendment to our Medicaid waiver, and it depends on whether the budget cuts are too significant or not, whether they're actually going to put this through or not.
Okay. Do you have the ear of legislators? I'm sure you've made some phone calls already.
Do. Us pediatricians are pretty vocal. We want to protect our little people in the state, and at Healthfirst as well. We have over 600,000 children in Healthfirst, and I feel very protective of them as a pediatrician that makes sure that they all keep their coverage.
So you've started your lobbying and your campaigning already.
Absolutely.
Sounds like you've gotten the attention of some assembly members and senators, correct?
Yes, we've been working with the Hispanic Caucus, we've been working with the Robert Hood Foundation and other groups.
Prognosticate for me. You think it'll pass?
I think it will. I think people understand how vulnerable small children are. People understand this is the way to give them the best start in life. And we're willing to help them any way we can.
Okay. For those people who might be watching, who want to enroll, but like you said, have never done it before, I know that part of your mission, part of what you do is to help people get the paperwork done.
Yes,
correct?
Healthfirst has done everything we can to make this as simple as possible. We have representatives who speak Spanish, who can help on the telephone. We have over 25 community offices spread all over the different boroughs. People can go with their paperwork. People do go with their paperwork and say, ayúdame, you know, translate for this for me, help me fill it out, tell me what I need to do, and we are willing to do that in all of our settings.
How long and detailed of a process is it? If I walk in with my son or daughter and I say I need help, I mean, am I there all day? Am I there for a couple of hours?
No, I don't think it would even be a few hours, but it's a matter of knowing what you need to do with the paperwork, having somebody walk you through it, and then knowing what you need to follow up on in the process.
We've got about 30 seconds left. Passage of what you're proposing for kids age 0 to 6, I'm guessing would maintain those high enrollment numbers that you've seen in 2022, yes?
It would maintain the high enrollment numbers, and it would get kids access to care continuously with no gaps and get everything that they need for the first 6 years of life.
Okay, bueno, keep us posted. We'll be watching. Thank you, doctor, very, very much.